Control Coordinator, Homabay. I'm pleased today to talk about malaria situation in the country and more so in Homabay County. Malaria is a treatable and is a preventable disease, and it's our #1 killer in our Lake endemic region that consists of Homabay, Migori, Siaya, Kisumu, Vihiga, Bungoma, and Busia. Malaria generally affects all of us through the mosquito bite, where we have the Plasmodium parasite that causes malaria, and nobody is immune to malaria. All of us can contract malaria as a disease. So malaria, we've been doing well from the year 2020 malaria indicator survey that shows that we have really dealt with malaria, and as per Homabay, we are doing at 4.6, down from 17% prevalence, which is a good show. We have several interventions that we put as a county and as a national malaria program, most of it being on malaria control. We had the vector control that we are doing, the mass net distribution, we are doing the routine net distribution, where we are giving nets, free nets to mothers who are pregnant and to children under 1 year old. We are also doing mass net distribution every 3 years. We are giving these to the whole population. We have done a lot when it comes to mass net coverage, though we still have a problem when it comes to usage. Most of the people who have the nets do not consistently use the nets as prescribed by the healthcare providers. We are also doing a lot when it comes to IRS, that is indoor residual spraying in Homabay and Migori County, and we'll be having the indoor residual spraying again in Busia County. That is one of the ways that we really control malaria, and we are requesting the public to allow our people, whenever we are doing the spraying, to allow our people to do the spraying. We're also doing a lot, and we are asking the mothers who are pregnant to visit the facilities for the ANC antenatal clinic as early as possible, whenever you find out that you're pregnant, so that we start ANC visits as early as possible. This is beneficial to the mother and the child, the unborn child, because the mothers will always receive free nets that will prevent them from contracting malaria. They will also be receiving the preventive medication, that is the SPs, during the visits. So it's very important for our mothers also to come to the facility whenever they realize that they're pregnant as early as possible. We are also doing a lot when it comes to the larval source management. We are doing larval source management where we kill the larval stages of the eggs of the parasite in the swampy areas. We are doing a lot again in malaria control, because we are doing social behavioral change. We are doing a lot when it comes to talking to our clients to make sure that they really appreciate the few or the many interventions that we have as a Department of Health. This we are doing from the facility level to the community level. We're also doing the case management, the active case management from the facility, where we advise whenever we feel you are sick, whenever you feel you have the symptoms of malaria, you come to the health facility. Then we direct you, we do tests, and then we treat. We also have the component of community case management that we are doing with our very able and trained community health promoters who are trained to test, treat, and track, and even refer as appropriate. So it's a very big elephant in the house that we really tried to intervene as the Department of Health, so that we have the malaria cases go down. We also have the hybrid process of malaria management, where we involve all other stakeholders. We've involved the schools, where we have the teachers are brought on board, so that we talk about malaria for the children and the students to know exactly what malaria is. We've tried to bring in the provincial administration during our activities, so that this becomes not only a Department of Health issue, but it all affects all of us. So it's very important to deal and to listen to the messages that we are giving on malaria control. Malaria, as I said before, is our #1 killer disease in the lake endemic region. And it presents differently. It presents, some people say it presents with signs and symptoms. Some experience headache, fever, they have joint pains. Then we also have malaria cases that are going, if they have not been managed well, then they become severe cases. Severe cases are cases that present with, if you get a child starts convulsing, child starts vomiting everything, the body can turn to yellow, the child can be anemic, and these things affect all of us. Those who are the worst affected are pregnant women and children under 5 years. That's why we are saying every pregnant woman to come to the hospital to receive the prevention that we are offering, that is free of charge. We are giving the SP, we are giving the nets, and the children under 1 also we are giving the nets. We are also preventing malaria in children under 2 years, where we are doing the vaccination. We are doing vaccination for children from 6 months. We are doing the first at 6 months, the second dose at 7, at 9, and then we are doing the fourth one later after the 24 months. So we are requesting our mothers who have children to please bring them to the hospital. Let us vaccinate our children so that we don't have children who are still experiencing severe malaria, severe forms of malaria. As you know, malaria affects us, not just when it comes to the health-wise, but when anybody is sick, it affects the children, cannot go to school, so it affects the academics. If it's a man or a woman who works, it affects the economic status of the family. So malaria is a disease that needs multidisciplinary approach so that we end malaria. We have a roadmap towards malaria control and malaria elimination in the country. And as Homabay, we've really tried as much as possible in the rest of the country to make sure that all these interventions are available to the public free of charge, and we really encourage the public to visit the health facility whenever you feel you are sick. Please don't go to the chemist and take drugs. Just go to either healthcare provider, or you can go to the community health practitioners so that you get the best medication, the best management for malaria.